Well, it's the annual open enrollment time, and we're here today talking with Sharon Campbell, Director of Benefits and Compensation, and Mary Hansel, who's our Benefits Manager. Sharon, I hear we have some good news this year.
We certainly do. We're changing administrators to Employers Health right here in Green Bay, and we think this is going to bring some great service to you.
Sharon, why did we make these changes?
We're constantly looking at all of our benefit programs, and when we evaluated Employers Health, we think they have some great things for you. One of the areas that we think is most important is that in our business, we're always talking about customer service and how we can serve the customers better. Well, we think Employers Health will do that for us, their customers.
Sharon, so does that mean that filing claims is going to be any easier?
A lot easier. Filing a claim simply means that you'll send the doctor's or the hospital bills in to employers and it'll be paid. It's going to be great.
You mean we won't have to fill out any forms, we just send the doctor's bill right to employers?
That's exactly right.
That sounds terrific.
Mm-hmm.
Mary, how about some of the other special features that Employers is offering?
Employers is giving Shopko a toll-free number, and what that means to you is you're able to call this toll-free number whether you're at work or at home, and there's going to be no cost to you to make that call. So you won't have to hesitate about making that call if you have a question about your claim. And we thought that was really important. The other thing that you aren't going to see, but we saw as we were touring their facilities, is that in their claims unit, they actually are able to monitor your calls coming in. So they can see how many calls are waiting, how many are actually being answered, how many operators are busy, and that really backs up their service, because if they get behind in their calls, they're able to get more people out on the floor to get those questions answered for you. The other thing that they're going to be doing is giving you an intro call, which simply means that once Employers, starts processing our claims for us, they'll be giving you a call just introducing themselves, who they are, and a little bit about some of the services that they offer. And of course, at that time, you'll be able to ask them any questions that you might have about the plan. So you can be expecting that call probably sometime in January. There's over 7,000 people that they have to call, so it may take a little while, but you will be hearing from them.
Does this mean claims will be processed any faster?
Yes, one of the unique features that we saw with Employers Health compared to other insurance companies is that if they have a question about a claim, they will call your doctor or the hospital or yourself to get that question answered versus writing you a letter about it. And I think when you think about that, you'll realize how quickly that will make that turnaround time in paying that claim. And that just means your bills get paid quicker, and you don't have the hassles with the hospital or doctor calling you about that. And we think that's a very valuable service.
Mary, now when do we stop sending claims to Prudential?
Employers Health is going to start processing our claims incurred on January 1, 1992. Now, I think that needs a little bit of explanation. Prudential will process any bills that you have with your doctor or hospital, or any medical bills that you have incurred prior to 1/1/92. So if you go into the doctor or the hospital December 31st, for example, of 1991, that claim will be paid by Prudential, or you should send that into Prudential. For any claims that you have incurred starting 1/1/92, then you're going to send to Employers Health. Now, this may be just a little confusing to you, but all you have to remember is that any claims that you have incurred prior to 1/1/92, you send to Prudential. Anything after that, you send to Employers Health.
Sharon, are there any other new features?
There certainly are. Employers Health has a program called Handle with Care. It's a new maternity program, and it'll help you and Shopko. When you find out you're pregnant, within the first 3 months, the first trimester, you should call Employers Health. And their nurses there will work with you to ensure that you have all the information that you need in order to have a happy, healthy baby. The purpose of the program is to identify high-risk pregnancies. So they'll be asking you all kinds of questions. But it's a really neat program, and I think you'll feel really good about it.
I know when we were walking through the unit that handles the pre-certification, and we were talking with some of the nurses, there was this one particular nurse who had pictures of triplets that she worked with the mother on caring full term. And you could see a real special relationship that she had with the mother. The mother, in fact, was still sending her pictures of how the babies were doing. And that was very important to us because it was showing us not only that they were concerned about the pre-certification and making sure things were being done well, but there was a true human element there, that they were concerned and valued that relationship. And I know the mother, one of the comments that the mother had made was that she felt a value talking to the nurse, because she perhaps asked the nurse questions that she didn't ask her doctor or forgot to ask her doctor. So there's a true value that was added with that particular unit, and we think you're going to like it.
It was really special. When we went into the unit, the nurse came to us and said, "Look at my babies, look how cute they are." They were really excited, and I think you'll like the program.
Mary, what about other cost controls in the program? We've heard about controlling costs for a number of years now.
Yes, we are. I think all of you are familiar with the pre-certification. It was called PruPass with Prudential, where you had to call in to Prudential prior to hospitalization to get that approved. And you could also then find out about procedures and other things at that time. Employers Health has a program very similar, but it's much more expanded. It's called Care Plus. And not only do you have to call in for inpatient hospitalization, but you'll also be calling in for inpatient and outpatient hospitalization, as well as inpatient and outpatient psychiatric care, hospice care, home health care, and I think nursing home care was the other one. So there are a lot of additional things that you're going to have to do prior to any one of these types of services, but it's there not only to help control costs, but to perhaps answer questions you might have about these programs. And I think if we can get those answered and you can make well-educated decisions about, you know, what you're going to be having done, that'll help you in the plan as well as us control some of those costs.
Now, how does wellness fit into this program?
We're changing our wellness package just a little bit, and I think you're going to like it. Some of you may be familiar with our schedule of, for example, physical exams that you have to go in. I know between certain ages you have to go, you can only have a physical exam like once every 3 years depending upon your age. We decided to hopefully make this a little bit easier, and instead of a scheduled number of times that you can have the exams, we're just going to give you a flat dollar amount of $300 to spend for these wellness type programs, and I think that'll be a little bit easier for you to understand, and also if you want to go in more frequently you can do that as well.
Is that $300 a year, or is that a lifetime benefit?
That's $300 a year.
Sharon, we've been talking about costs. Are we in for another big bump in premiums this year?
Costs are a really difficult thing to address. 2 years ago I came to you, and unfortunately we had a 27% increase in costs. This year, because of all the features that we've had in the plan, because of your good cost controls, because of many of the features that we've talked about today, we're only going to have a 5% increase in premiums this year. That's really good news for all of us, and your efforts are working.
I know I was at a recent seminar that discussed medical care, and we had the opportunity to interact with a lot of large employers throughout the nation, and the lowest increase I heard for this year from some of those employers was 10%. So we're doing real well with 5%, and I think that's a tribute to all of you out there, as well as some of the design features we have within our plan.
So the bottom line is our cost controls are starting to pay off for us, right?
Yes, yes. It'd be great if we didn't have any, but unfortunately that's not reality right now, but it's better. 5% is better than some of the other things that are happening in the industry.
Mary, with the change to Employers Health, will everybody who's been in the plan automatically be transferred?
No, they're not, and that's probably going to be our biggest challenge. We're going to ask all of you to fill out, again, new enrollment cards. The last time we did this was a couple of years ago, so in order to get off on the right foot with Employers Health, we would like to have you fill out, or we need to have you fill out these new cards. And on those cards you're going to select whether or not you want the health coverage, or whether you waive it, whether you want dental coverage, or whether you waive it, or whether or not you want life insurance coverage. So it's going to be very important that you fill out these cards and provide us with all the correct dependent data as well as coverage data. Otherwise, we're not going to get you input into Employers Health system correct.
So that means that anybody who's eligible for the plan needs to fill out a card whether they want the insurance or not.
That is correct, and we'll be sending lists to all the operations administrators so they know who those people are. But yes, we need to have everybody fill out as though you have never seen this card before, so pretend it's the first time again.
Mary, what are the dates of open enrollment, and when are the cards due back here at the office?
Okay. We're going to be getting this information out to the stores during the first couple weeks in October, and we're going to need to have this back around the first part of November. And then, of course, the open enrollment changes will be effective January 1st.
Now, Mary, this is general information. We'll be sending out memos and check stuffers to go over the details?
Yes, we will be sending out a detailed information, not only with information about employers, but also information about what the actual rates are, as well as some of these new programs that we talked to you a little earlier about.
So if anybody has any questions about this after reading the memos and the check stuffers, who should they call?
They can give us a call. That's what we're here for.
Okay, we've talked about a lot of things. Why don't we just review the key points now? Sharon?
Of course, the key point is going to the new administrator, Employers Health. There's no major changes in the plan, and we have greater service for you, our customers.
And some of the special features that we have in the plan are no claim forms. You'll also be provided with a toll-free number. Your questions on claims will be followed up by phone. And of course, we still have our cost control programs, our pre-certification program, which is called Care Plus.
And the good news about the rate change, a 5% rate change this year.
The open enrollment dates, we'll be sending the information out to the stores the first part of October. We'll need them back here to the GO by the first part of November. And the most important thing is remember to fill out your new enrollment card.
Sounds terrific. Thanks, Sharon and Mary. And to wrap this up, let's go meet some of the people who'll be serving us at Employers Health.
Welcome. I'm Bill Lawson, President of Employers Health Insurance. We at Employers Health are proud to be associated with a quality firm like Shopko. Like each of you, our people are committed to quality customer service. Now, I would like to introduce some of the people who will be working closely with you.
Hi, I am Sherry Bougie, and I am an investigation analyst that will be helping with the Shopko account. I will be responsible for contacting providers and insureds to obtain additional information for processing the claims.
Hi, I'm Roxanne Hansford. I'm the Claims Processing Supervisor responsible for the Shopko account. On behalf of myself and my staff, we'd like to welcome you to Employers Health.
Hi, my name is Renee Oski. I'm a benefit analyst at Employers Health Insurance. I am one of the benefit analysts who will be handling the Shopko account, and I'd like to welcome Shopko aboard.
Hi, I'm Sherry Daft. I'm a benefit analyst too. I'll be working on your medical claims and also on the more complicated ones.
Hi, my name is Brian Vandenbert. I'm a benefit analyst. I process medical claims for the Shopko account, and I'd like to welcome Shopko to Employers Health Insurance.
Hi, my name is Heidi Biller, and I'm a benefit analyst on the Shopko account, and I'll be processing your medical claims.
Hi, my name is Karen LeClaire. And my name is Pat Petzel. And we're medical review coordinators. We pre-certify your in-hospital stays and surgeries.
And for maternity, we ask you to call as soon as you find out you are pregnant so that we may monitor the care of you and your baby.